First, tell us what we're seeing, what appears to be a trend now, more cases in Kano especially.
Yeah, so right now what we're seeing in Kano is an ongoing community transmission. And at this point, the government of Kano will have to do a lot with regards to community engagement. We know that people in the north usually live in clusters, and most times they live in small settlements of clusters. So at this point now, the government would need to engage the people that they would listen to.
So more
The traditional leaders, yes, their community leaders, their religious leaders. The government now will have to aggressively start a community sensitization there, and also start maybe an active case surveillance there, so they don't have to wait for the situation to escalate more than this, because I don't know if Kano will be able to handle the situation if it goes any worse.
When we talk about expertise in terms of health workers, do you think they can handle it, especially health workers that are spread across other states?
Yeah, you know, in the north, they don't have enough doctors there. So it's going to be a very big problem. So what they need to focus on right now is prevention. And that is the reason why the government will have to do a lot in terms of prevention. So having to educate the people using the channels that they would ordinarily listen to.
Now, we're also witnessing a higher number of deaths in Lagos, and some would argue not so much compared to the global community. But then what is happening in Lagos? We know that some of these cases, the patients are said to be having underlying causes, but what is it with this virus that, it appears to attack so much, and, we're losing a number of people?
Yeah, for Lagos State and with the coronavirus, I think what we're beginning to see now is a community transmission, first of all. And for most of the people, number of cases of death that we've had, they've all had underlying illnesses, and then maybe people who had hidden the truth about their history at some point. So for Lagos State right now, it still comes down to trying to get the message across. Because like we all know, it's novel, so research is still going on. And from people who have been infected, from stories that we've heard from the survivors, you will see that most times when they came in contact with this virus, they didn't even spend up to 2 minutes. Just 1 minute is enough. So the situation is very tricky, like I've said before, and we now have to maintain very high index of suspicion always. So we have to now, at this point, take preventive measures very seriously. Now, the government is saying, yes, they're going to start ensuring that everybody uses a face cover, and then, but at the same time, we also have to observe social distancing and all other precautionary measures like hand washing and the rest of them.
So far, do you think that is working? I know we have the lockdown in Lagos, the federal capital, and then Ogun State.
Well, the active case surveillance, we've been able to fish out people, but for the stay-at-home order, it's really disheartening when you go out there and then the number of people you see on the roads. Even getting here, I got into a traffic, getting to the studio here today, and you see that a lot of people really do not understand what this virus is about. They just feel like, oh, this is some avenue for the government to just, enrich themselves and all that. And what we're saying at this point is that this thing is real. What you're seeing now, people are being infected every day. So people need to really take this stay-at-home orders. Yeah, there are a lot of sentiments, a lot of issues have been raised with regards to security, palliative, Nigerian being an economy that lives from hand to mouth and all that. How are people going to survive? So it has to be a two-way thing. The government taking responsibility in some part, and then the people also taking responsibility in some part.
As we let you go, fact or fiction, when it comes to face masks, what are we supposed to do? The local face masks, will they be effective in curbing the virus briefly?
The local face masks are going to serve as a barrier. So even if we're going to wear them, we still have to observe social distancing. Yes.
All right. We appreciate your time, public health physician Anna Koma. Thank you for joining us.
Thank you.